Hello everyone, my name is Isabella and this is my presentation on the phenylketonuria disease. So what is phenylketonuria, also known as PKU? Phenylketonuria is an inherited disorder that affects the body's ability to break down an amino acid called phenylalanine. PKU typically involves a special diet that is low in phenylalanine, as well as supplements of other essential amino acids. Phenylalanine is an essential amino acid found in proteins and is important for proper growth and development. It is obtained from eating certain foods such as meat, eggs, nuts, and milk. People with PKU have abnormally high levels of phenylalanine in their blood, which can cause severe developmental and neurological problems if left untreated. So right here is an example of how a healthy person metabolizes phenylalanine properly, breaking it down into tyrosine with the help of the enzyme phenylalanine hydroxylase. In a person with PKU, however, the enzyme phenylalanine hydroxylase is missing or not working properly, causing the phenylalanine to accumulate in the body. So now I'm going to talk about some signs and symptoms of PKU. Usually includes intellectual disability, behavioral issues, developmental delays, seizures, a skin rash, musty odor, and light sensitivity. So over here, we can see this image shows early signs of PKU. We can see a baby with PKU may show signs of microcephaly right here, including a head circumference that is significantly smaller than average. Also, PKU include developmental delays. Other symptoms of PKU may include vomiting, eczema, and pale skin. Now, some possible PKU treatments include dietary treatments, drug therapy, gene therapy, organ transplant, and enzyme replacement therapy. Treatments for PKU includes a strict diet that is low in phenylalanine. This diet should be started as soon as possible as it can help prevent serious complications. In some cases, medications such as Kuvan, right here, may be used to lower the phenylalanine levels. Now, some possible causes and risk factors include causes genetic mutation in the PAH gene. So the PAH gene encodes an enzyme known as phenylalanine hydroxylase, which is responsible for converting the amino acid phenylalanine into another amino acid tyrosine. Some risk factors include family history of PKU, ethnicity, low birth weight, and preterm birth. In this visual, we can see how PKU is an autosomal recessive disorder. This basically means that both parents must carry and pass on the mutated gene in order for the child to be affected. Now, how do we test for and diagnose for the disease? PKU is usually diagnosed at birth through a blood test. The test looks for elevated levels of phenylalanine in the blood. A genetic test may also be done to confirm diagnosis. How to prevent PKU? Avoiding foods in high phenylalanine, such as artificial sweeteners, certain protein-rich foods, and aspartame. Taking a supplement to replace phenylalanine in the diet. Following a diet plan that is low in phenylalanine and high in fiber and essential vitamins. Regularly monitoring blood and urine levels of phenylalanine. regularly visiting the doctor for checkups, and taking medication to help manage the condition. For the cell and molecular biology of the disease, on a molecular level, PKU is caused by a mutation in the gene that encodes for the enzyme phenylalanine hydroxylase. This enzyme is responsible for converting phenylalanine into tyrosine, an important building block for proteins. When PAH is absent or not functioning properly, PHE builds up in the body and can cause severe neurological problems. At the cellular level, the accumulation of PHE can cause damage to the brain and nervous system. This is because PHE disrupts the production of certain neurotransmitters, such as dopamine and serotonin, which are essential for normal brain function. As a result, people with PKU can experience a range of symptoms, including intellectual disability, seizures, and behavioral problems. Here we can see how this mutation causes the enzyme to be unable to convert phenylalanine into tyrosine, right here, leading to a decrease in tyrosine and an increase in phenylalanine in the body. So that finalizes my presentation of phenylketonuria. Hope you enjoyed. Thank you so much for watching.